this is concerning National Health Service, which is, of course, the United Kingdom's health service to the public. It's amazing. These types of revelations and new medical procedures are really astonishing and very happy news. Cancer patient saved by seek and destroy cells stuns doctors with recovery after being given just weeks to live. So there are, of course, patients that are at the end of their lives and they do agree to have some kind of a procedure which is a medical research procedure, and this patient obviously had only a few weeks to live and he decided to try this procedure out. He was saved by seek and destroy cells that destroyed his tumor, his cancer. Barney Coleman for Mail Online did this, Mail on Sunday. The first NHS cancer patient to benefit from a breakthrough procedure. The procedure primes the body's immune system to seek and destroy, quote unquote, the tumor cells, has stunned doctors with his recovery after being given just weeks to live. Paul Field, 55 years old, was diagnosed with melanoma, the most deadly form of skin cancer, in December of 2013 and had numerous surgical and drug treatments, all of which failed to halt the spread of the melanoma, the cancer. He was a married father of two from Flitwick, Bedfordshire, believed he had run out of options when he was offered a tumor-infiltrating lymphocyte, TIL for short, TIL for short, tumor-infiltrating lymphocyte therapy last month. Studies show the treatment is effective in at least half of the patients who have not responded to any other approaches, including surgery, standard chemotherapy, radiotherapy, and other newer immunotherapy drugs. So, okay, these are very invasive, very harmful. We're talking about chemotherapy, radiation, surgery, and the like, and that's really very, the patient suffers because of this. The third of these patients who faced a particularly bleak prognosis are alive and well, simply requiring monitoring a year after being treated. Many of these patients will be cured, said specialist Dr. Hendrik Tobias Arkinau of the Sarah Cannon Cancer Centre in London, where the British TIL therapy trials are being spearheaded. He says you can see it working. The tumors on the skin visibly fall apart and shrink. It feels as if we have cracked the code with this disease, and there may be further success with other hard-to-treat tumors, including cervical cancer. Mr. Field, who was given the treatment as part of a new trial, Dr. Arkino added, "We have watched his cancer reduce in size every single day." TIL therapy is a type of immunotherapy which involves harnessing a patient's own immune system to fight the cancer. It's one of a number of treatments known collectively as adoptive cell transfer, or ACT, which all entail removing some of the patient's own immune system cells, multiplying or modifying them in the lab, and then infusing them back into the patient so they can do their work. TIL therapy involves growing immune system cells known as T lymphocytes taken from the surgically removed tumor. So they take the cells from the tumor. Physicians modify the cells in a laboratory, increasing their potency against the cancer by picking out the most active cells and multiplying them. The patient receives a form of chemotherapy or other drug which give the T lymphocytes a better chance to grow and reproduce before the lab-grown cells are reintroduced through a drip infusion. The patients remain in hospital for 2 weeks in total. The new T lymphocytes travel throughout the body where they attack tumor cells wherever they appear. Dr. Arkinau said, "We are also exploring whether the TIL cells can be frozen, so if the cancer returns, we can use them again to top up, quote unquote, the patient's own reserves." TIL therapy is still considered experimental, but there are about 24 studies looking at it as a treatment for skin and other cancers with promising results. The UK trials led by Dr. Anno are being carried out in conjunction with the HCA Healthcare UK at University College Hospital in London, and other hospitals across the country are also expected to sign up in the near future to try this out. About 13,500 new cases of melanoma skin cancer are diagnosed each year. More than a quarter of the cases are people in their 50s, and over the past decade, the number of people diagnosed with melanoma in the UK has increased by almost half. Well, we know that a lot of UK people travel to Greece for their anything from spring to summer to winter vacations, and the sun is very, very, very strong in Greece. I mean, just 15 minutes you can really get a bad sunburn, especially if you haven't been out in the sun and conditioned your skin slowly to sun exposure. And a lot of these, Northern Europeans or Scandinavians or Brits that come to Greece for their holidays even get sunstroke. I mean, it's really bad, sun poisoning, because they don't, and years later, decades later, they end up having skin problems, especially skin cancer or even melanoma, unfortunately. Overexposure to ultraviolet radiation is the main trigger for the disease. For melanoma and those with fair skin and eye color, a large number of moles or freckles and a family history of melanoma are all at higher risk. Just a decade ago, the majority of patients were expected to survive no more than a year after the diagnosis, but in recent years, new drug treatments, including immunotherapy drugs, ipilimumab, I still can't read that, and nivolumab, have transformed outcomes of the therapy. TIL therapy may be the first real option for cases that fail to respond to all of these medications. Mr. Field, the patient, was diagnosed with melanoma 5 years ago, and he says, "I'd noticed a suspicious mole on my right shoulder blade a year earlier, but my GP told me it was nothing to worry about. Then, on a family holiday, my wife Helen took a look at it and said I really needed to go back because it was black and crusty and bigger, almost 2 inches wide. I went to a skin cancer clinic, and within 2 weeks, I'd had surgery to remove it. I was left with a 10-inch scar on my back, but the cancer had already spread." Over the following years, Mr. Field had numerous operations to remove tumors that reappeared and was offered ipilimumab and nivolumab, which failed to halt his disease. He said, "When my doctor told me about TIL therapy, I jumped at the chance," and he says, "I was just so pleased there was something else to try. I'm feeling better every day, and the skin cancers are disappearing. My chances were not great before this, but the way I feel now, I reckon I'll be around for a while yet." That's fantastic news. We're very happy for him, happy that this works. Great news.